Hey, good morning. Glad to be with you again. As I often say, this is the my favorite part of the week, and I'm so glad that you're here. Really honored that you're taking the time to make this part of your Saturday morning. We're going to kick things off this hour talking about functional health and some problems that many people have that traditional medicine just can't seem to resolve, but they find some assistance and they find a path to better health in the care of Dr. Lee Nagel, who is the founder of Midwest Functional Health. He's a certified chiropractic wellness practitioner. I welcome you to the program.
Thank you. Thank you for having me.
So give me the big idea here. What is functional health?
Well, basically, we use the term functional health because it's kind of like saying it's customized or personalized to each patient due to, whatever condition they might come in with, their levels of toxicities or deficiencies that's actually driving their health problems. And, through a comprehensive evaluation and some testing, we can figure out a path to wellness for them.
So you're really kind of trying to get to the root cause of the illness and not treat symptoms.
Without a doubt. Yeah. Without a doubt.
So what kind of conditions do people come to you with, and kind of what's their life story?
Well, really a lot of conditions come from toxicity and deficiency issues, a lot of the conditions that we're dealing with now. We have all sorts of autoimmune conditions like psoriasis, rheumatoid arthritis, lupus, brain problems that can be driven from toxicity. So early dementia, Alzheimer's, spectrum disorders, and children. Even now adults we're getting adult onset spectrum disorders that can really be helped with a multi-therapeutic approach addressing the toxicities and deficiencies.
Well, let's just jump in right there. So when you're talking about adult onset spectrum disorder, you're essentially, spectrum disorder typically refers to autism-related conditions.
Right.
And so these are adults who are experiencing symptoms of autism?
Yeah. So, in medicine, we, check boxes. Well, not we. I'm not a medical doctor, but to get a diagnosis, to put them in a category. And it's really just not the way we look at anything. I mean, we look at our genetics have been the same for tens of thousands of years, and we've had this drastic increase in diseases across the board. And with our genetics being the same, why are we having spectrum disorders where, autism was 1 in 10,000 in 1966, and now it's 1 in 30.
Yeah.
And we have dementia skyrocketing, and Alzheimer's is skyrocketing, and, now we have adults that are on ADD meds, and they don't know why. And so we look at it as there's a toxicity and deficiency issue that's driving those cases. And so we really don't look at them as, there's not protocols specifically for dementia or specifically for Alzheimer's. We're looking at it as your body's healthy, and we've been, we have toxins and gut issues and food problems, and we address all of those issues to help them.
All right, so we're going to walk through each one of those and kind of talk about the food issues and the gut issues, and we'll get into toxicity a little bit later on. But give me just an example of a patient that you've helped with let's say, that adult onset spectrum disorder.
Yeah, so I have a great case with that kind of illustrates everything that we do. This is a client, mid-40s. She's actually, we have a comprehensive weight loss program, which is a bit of a side note, but she had already gone through those programs. So she had her food dialed in. She had, had all those things addressed, but all of a sudden had, she had been on ADD meds for 20 years. And then she all of a sudden had a blood test come back where she had high ANA levels. So what?
Yeah, what is ANA?
Yeah. ANA is anti-nuclear antibody, and basically what that means is the body is mounting an attack on itself. So we see this with lupus, sometimes you see it with cancer, you see it with, and sometimes the disease onset or the diagnosable onset hasn't started yet, but it means there's problems in the body. And her levels were 8 times normal, which just, then she got on Google and it scared her to death. So she came in for an evaluation at Midwest Functional Health. We did a Provoked heavy metals test, and high heavy metals would be, or high mercury would be say 12, and she was 45. And, with that, and she had already had that ANA test done. And so, like I said before, she already had her food dialed in. We worked with the gut, leaky gut, which I know, you've had guests on talking about leaky gut. That's a big deal these days. 5 months of detox. She was high in mercury, so she's obviously not a good detoxifier. So we had her mercury amalgams removed from her mouth. She had removed safely by a safe certified dentist. And after 5 months, she reduced it down to 19, which is still high, but she was able to get off her ADD meds. So obviously, the mercury was having an impact on her brain function. And we know that mercury is the most potent neurotoxin on the planet. Mm-hmm. And so, some people can detoxify and some people can't. And so, pulling the mercury out of her body and out of her brain helped her brain function, which really wasn't even part of her goal. When she came in, she just wanted to reduce the ANA. And along with that improved brain function, it shut the ANA off. It was negative. So when we did post-blood work on that, it just didn't show up.
So mercury and lead are two of the most noted of the heavy metals, right? And mercury comes from many different sources.
It does, for sure.
The coal-fired power plants,
without a doubt, we see it in fish, right? And the fish don't have amalgam filling, so it's not a focus on that. It's environmental. It's everywhere.
Yeah, and it is all around us. I just replaced, believe it or not, my house was built in 1953. There was a light switch that was original to the home, and it had failed. So I took it out and found out there was mercury in that light switch.
Without a doubt.
I mean, it's amazing. This stuff is everywhere. So you're seeing people that have an accumulation of heavy metals, but also with food-related problems. And I'm a big believer that food really affects our health. Give me some idea on what your teachings around food are.
Yeah. So, we always tell our clients that you can't get better without comprehensively addressing the food, but you usually don't get better by only addressing the food, which, that previous case I just mentioned illustrated that. So, the standard American diet is cereal in the morning, sandwiches at lunch, pasta at dinner. So we have a really heavy carbohydrate load for one. The processed foods usually have lots of chemicals in them, and that's a big part of the problem. And so we have high sugar levels, high insulin levels, and those processed foods are also full of chemicals that, cause leaky gut. So, I mean, you just have a whole bunch of problems that I guess, cause disease. So we address cleaning up the diet, so organic as possible. We monitor blood sugar and ketones, so it's a science that the blood glucose ketone index. So bringing the sugar levels down actually will help detoxify the cell. Mm-hmm. So sugar levels are inflammatory to a cell and cause problems. We also incorporate a lot of fasting strategies, which in 2000s, we've been doing this in our weight loss program for 7 years, like in package form, and it seemed very foreign to people, where we had the timing, the types of foods, like when to eat, what to eat, when to shock the body, all of those strategies 7 years ago, which that's kind of neat. In 2016, the Nobel Prize winner won it on fasting and autophagy and how you can downregulate autoimmunity, and they're looking at cancer studies, and I mean, just these amazing benefits from fasting and intermittent fasting and, diet variation. And so we implement all of those strategies with our patients.
We have a lot more to talk about with Dr. Lee Nagel from Midwest Functional Health, and we're going to do that here on the Health Call Live Radio Hour, and I invite you to join us with your questions if you're suffering from an autoimmune condition or just chronic health issues that you just can't seem to resolve. Maybe Dr. Nagel can give you a path to take. And you can join us on the phone at 800-333-1190 or 447-1190. Text us your questions at 46862. And we'll be right back with more of the Health Call Live Radio Hour on WOWO. So in the studio with me today is Dr. Lee Nagel. He is the founder of Midwest Functional Health, a certified chiropractic wellness practitioner, and we kind of covered sort of the big picture around what the theme of functional health is. But I want to drill down now on toxicity and this heavy metal toxicity issue that you deal with. So walk me through how you know what's in my body. What is this Provoked heavy metals test that you mentioned?
Yeah, so, heavy metals the different heavy metals have an affinity for different types of tissue. So mercury has a high affinity for nerve tissue. Lead has a high affinity for bone tissue. So, it's when we're exposed to that from whatever source there might be, it lodges in the tissue. So if you take a straight heavy metals test, like a urine test, and see, what metals are in your body, they're not going to be circulating. It almost always comes back negative. So, and if it did come back positive, that meant that, you ate fish 2 days ago or something. So
what you're saying there is, if it's not circulating the blood, it's trapped in the fat cells or in the neurotissues.
Without a doubt.
Okay.
Without a doubt. So testing that way really doesn't give us any useful information. So what we do is it's called a Provoked test. So we use a provoking agent to pull the heavy metals out of the tissue. So it goes into the tissues, pulls it out, and then it's calibrated so that you do a urine collection for 6 hours. And the test is calibrated for that 6 hours. And then we can see, relative levels of concentrations in the body. And, there's what the test considers high, and then, taking care of thousands of people, we have a big memory bank of what we see clinically too. So, the clinical application to that test.
And so what are some of the conditions that are associated with those toxins? So we talked a little bit earlier about adult onset autism behaviors.
Yeah.
But beyond that, early dementia, you believe, is also associated?
Yeah. So here's what it is. It's not a one-to-one. So when I talked earlier about this multi-therapeutic approach, we have gut problems, which research clearly shows plays a role in every disease, including dementia and Alzheimer's.
Yeah. I agree with that.
Turning on autoimmunity. So these gut issues, but the gut issues are also related to the toxicity issues. So there's a little bit of a hierarchy. So we feel like clinically that if you don't directly address the toxicity issues, it's really a stopgate for improvement. So most of the clients that have come to us have already done an autoimmune diet. They've already done a ketogenic diet. They've tried these things, gluten-free and casein-free, or dairy-free.
So they're struggling. They're searching.
Yeah, and so that those little changes get them better, and they feel better for 6 weeks or 2 months, but then they all come back. And the stopgate is the toxicity, and it's probably the most complicated factor to get better, because you really have to know what you're doing when you have chelators and binders and multiple levels of binders to make it safe and effective and not cause any problems. So addressing that is really a huge key to success of the patient for them to restore their health.
So help me understand the basic concept here. So we identify that I have some toxicity factor that is potentially associated with one of my chronic conditions.
Right.
And then you go through the process of removing those metals using chelation therapy.
Yeah.
And then how long does this take? Is it a one and done? Am I going to be doing this forever? What happens?
Great question. Yeah. It's not for one, to be clear, it's not IV chelation. We feel like that's really fast, and that's not what we do is slow and safe. So it takes years, not months. So we pre-frame that when we have clients come to us that it's taken a lifetime to get you sick. It's going to take a while to get you better. So yeah, it's a process. It's a stepwise process where we prepare the body for detoxification. So we work with, I'm going to use some big words here, but our cells are really dysfunctional. So, the body's made of cells, so you have to get the cells healthy to get the body to work like it's supposed to. So we prepare those cells with different fatty acids, mitochondria support, which is like the powerhouse of the cell or the battery, methyl groups so you can have correct genetic expression, which, the toxins that screw that up are plastics and a lot of the, chemicals in our environment. Clean the diet up, so the toxins there are bad oils like vegetable oils, sugar, and then we can start detoxing the body. And then if we need to, we can move to the brain, which pretty much everybody needs that. But we want that stepwise process so that we don't have any reactions. So if you just start straight into heavy brain detox, people have problems. So, and our clients don't. They just, when they follow the programs, they just don't.
So it's a lengthy process, but then once those metals are removed, am I clean? Do they come back?
Yeah, that's the great thing where, these other treatments, like if you change your diet, you didn't change the toxicity, so they'll feel a little better and it comes back. But when you remove those toxins from the body, I mean, it's forever. And we're exposed to toxins on an ongoing basis, so it's a good idea to do rounds of, like I do brain phases, probably every other month, just because I'm high in lead and mercury. I don't have any fillings or anything like that. I mean, it's just come from my mother, so there's another subject. There's 4 generations of toxicity that we get, and or whatever I've been exposed to in my environment. So I continually detox, but yeah, it doesn't come back. And once it's out of your body, that's the system is set up so that we bind with those toxins. They're not recirculating, and then it leaves the body.
So, cancer is the disease everybody fears the most. Second on that list is Alzheimer's. Tell me about dementia and what you've seen in improving the symptoms of dementia.
Yeah, so when we take on cases for dementia and Alzheimer's, we prefer to take them, any of those brain problems. We like early stage because then we have something to work with. It's really tough to get somebody at the late stage and is, can't remember their family and whatnot. And a side note is that's what got me into this, because my grandpa died of Alzheimer's and I was a health expert and I had no answers for it. All I knew was food and a little bit of gut stuff, 15 years ago. So anyway, that subject is near and dear to my heart. So if you can, I guess, intervene or you can start taking care of somebody with Alzheimer's early on, you can start addressing these toxicity issues before there's true neurological damage, plaquing, or at least, every case is different, like where they come in the progression of that disease. But we have great results with that. And when people are in their 40s and they start losing their ability, like we talked about ADD, that's a symptom of early onset. And, and doctors now say, well, you're 70. We're designed to live over 100 years. And my grandmother always said, she said, the old people when I was young all had their minds. They might be have bad hips and whatnot. She said, but I can't remember anybody with when I was a kid with Alzheimer's. Yeah, so
that's pretty widespread. So what can I expect if I have, let me back up a second. What conditions are most responsive to this type of therapy?
Really, all of them are responsive. I mean, we have a lot of thyroid cases, which aren't necessarily life-threatening or anything like that. Mild autism, we've had great results with. Definitely spectrum disorders, and like I said, early onset. I mean, we just have great results with all of them.
So a symptom that I should be looking for, or what are some indications that I might have a toxicity-related issue?
Well, energy for one, and it might be when you're looking at brain toxicity, it might be brain energy. So, you used to be able to have a clear head all the way through work and come home and do homework with your kids and, get tired when you're supposed to. And now that seems to be going away, and you just chalk it up to aging, or I'm stressed, or we make excuses rather than addressing it. Sleep issues, anxiety, chronic depression, weight loss resistance. So, I mean, that's our expertise also. Like I said, we have true weight loss solutions for 7 years. And if somebody's toxic, the body holds those toxins in the fat, and the body doesn't want to release it. So sometimes we have to do a combination of those things.
Well, we have to leave it there. We have exhausted the half hour, if you can believe it or not. That's Dr. Lee Nagel, the founder of Midwest Functional Health. You can find out more about them if you want to go to the website, and that is MidwestDetoxSolutions.com. One more time, MidwestDetoxSolutions.com. Glad to meet you. Thanks for coming in.
Hey, thanks for having me.